Hey everyone, welcome back. Thank you so much for tuning in.
I hope you're having a wonderful day. I'm diving into a very important topic that many of you requested, understanding lupus, its symptoms, causes, doubts, and how to live well despite it.
Lupus is often called the invisible disease, and that's what makes it so challenging.
I mean, you might look fine, but inside your immune system is waging a battle against your own tissues and organs.
It's a frustrating reality for many. In today's video, I'll shed light on this intricate disease, providing insights into its nature, signs, potential triggers, and how to maintain strength while living with it. Lupus can be confusing, but knowledge is power.
Together!
We'll navigate through this maze of information, equipping you to better understand and manage this condition. Remember, you're not alone. We're all learning and growing together. Let's get started. What is lupus? Imagine your immune system as your body's defense shield, protecting you from harmful invaders like bacteria and viruses. Now picture what happens if this shield, meant to be your protector, turns against you. Well, that's essentially what happens in lupus. Lupus is an autoimmune disease, meaning your immune system mistakenly attacks your own tissues. In a normal immune response, your body produces antibodies that recognize and fight off foreign invaders like bacteria or viruses. However, in lupus, something goes wrong, and these antibodies start attacking healthy cells and tissues, leading to inflammation and damage in various parts of the body. Lupus can manifest in different ways, each with its unique characteristics. The most common form is systemic lupus erythematosus, SLE. This type affects multiple organs and body systems, making it a complex and multisystemic illness. On the other hand, cutaneous lupus primarily affects the skin. Drug-induced lupus is a type that's triggered by certain medications and often subsides once the drug is discontinued. Finally, neonatal lupus is a rare form that occurs in babies born to mothers with lupus. Now that we've covered what lupus is, let's explore the symptoms. These can be quite diverse and vary greatly from person to person. Some common ones include persistent tiredness, joint pain, stiffness, or swelling, especially in the hands, wrists, and knees, as well as skin rashes, particularly a butterfly-shaped rash across the nose and cheeks. People with lupus are often sensitive to sunlight. Even slight sun exposure can trigger rashes or flares of other symptoms. Fever without a clear cause, hair loss, mouth or nose, ulcers and changes in the fingers, such as turning white or blue when exposed to cold temperatures, known as Raynaud's phenomenon. When lupus affects organs, the symptoms become more serious and may include chest pain, difficulty breathing, kidney problems, seizures, or even heart issues. Because lupus is so complex, it can mimic the symptoms of many other conditions, which is why it's often referred to as the great imitator. Now let's discuss the possible causes of lupus. The exact cause remains unknown, but it's generally understood to be a combination of genetic, hormonal, and environmental factors. Genetics play a significant role. If you have a family member with an autoimmune disease, your risk of developing lupus increases. Hormones also seem to be a contributing factor, which explains why lupus is more common in women, especially those in their childbearing years. Environmental factors can also play a role. Sun exposure, certain infections, smoking, and even stress can trigger lupus flares. Additionally, some medications can induce lupus-like symptoms. Diagnosing lupus can be a journey in itself. As I mentioned earlier, it can mimic other conditions, and there's no single test for lupus. Doctors rely on a combination of evaluating symptoms, conducting blood tests, and assessing organ function. One common blood test is the anti-nuclear antibody test, ANA, which detects the presence of certain antibodies often found in patients with lupus. However, a positive ANA test doesn't confirm lupus. It merely indicates the possibility of an autoimmune disease. Many patients spend years dealing with the confusion of undiagnosed symptoms before receiving a lupus diagnosis. Let's now talk about the challenges associated with lupus. One major challenge is the unpredictability of the disease. One day you might feel fine, and the next you could be in the midst of a flare that knocks you down. This unpredictability can impact your work, relationships, and daily life. Another challenge is that lupus is often invisible. People who do understand the disease may not believe you real because you look fine on the outside. This can lead to feelings of isolation and misunderstanding. Living with lupus requires a unique blend of patience, resilience, and adaptability. It's crucial to understand your triggers and develop strategies to manage them effectively. Let's explore some of these triggers and coping mechanisms. Sunlight is a common trigger for lupus flares, so protecting yourself from the sun is essential. Wearing sunscreen with a high SPF, protective clothing, and avoiding peak sun hours can help prevent sun-induced flares. Certain medications can also trigger lupus symptoms. If you notice that a specific drug seems to be causing a flare, discuss it with your doctor. They may help you adjust your medication or find alternatives. Infections can also trigger lupus flares. While you can't avoid all infections, practicing good hygiene, getting the flu shot annually, and washing your hands frequently can reduce your risk. Stress is another significant trigger. Finding healthy ways to manage stress, such as through meditation, deep breathing exercises, yoga, or spending time in nature, can be beneficial. Effective treatment of lupus involves a multifaceted approach that often includes a combination of medications and lifestyle adjustments. Medications commonly used include non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen to manage pain and inflammation. Antimalarials such as hydroxychloroquine help with fatigue, joint pain, and skin rashes. Corticosteroids like prednisone are powerful anti-inflammatory drugs that can be effective, but they also have potential side effects. Immunosuppressants, such as methotrexate, help calm an overactive immune system. Biologics are newer drugs that target specific parts of the immune system. These include belimumab, which helps reduce disease activity. The choice of medication depends on the severity of symptoms and the organs involved. Treatment isn't just about managing symptoms, it's about preventing long-term damage. Regular checkups and monitoring are vital to ensure that the treatment plan is working well. Living well with lupus goes beyond medication. Lifestyle factors play a crucial role. Maintaining a balanced routine that includes rest and gentle physical activity can help manage symptoms. Regular loom-packed exercises like walking, swimming, or cycling can help maintain overall health and well-being. A healthy diet rich in fruits, vegetables, and whole grains is also important. Eating anti-inflammatory foods can help reduce inflammation in the body. Getting enough sleep is crucial as fatigue is a common symptom of lupus. Aim for 7 to 8 hours of quality sleep each night. And finally, staying connected with others and building a support system can help you cope with the emotional and practical challenges of living with lupus. Consider joining support groups or connecting with others who understand what you're going through. Remember, you're not alone. I hope you found this information helpful. Please share any questions or thoughts you have in the comments below. Your comments help us create more valuable content for you. And if you found this video informative, please hit the like button and subscribe for more health insights. Thanks for watching. Stay healthy and take care.